Hello, I'm Kieran Anderson. I'm the group publisher here at Applied Radiology, and I'm thrilled to have Dr. Suzie Bash, a neuroradiologist, a medical director at RadNet, sitting with me in our booth today. Suzie, so good to see you.
Thank you, Kieran. Wonderful to be here.
Well, I am very happy to have you here because you are the perfect person to talk to about some of the latest trends in radiology. And you are on the cutting edge of so many things as it relates to artificial intelligence and innovation in this field, and the things that you're doing in your practice and the tools that you're using. So I'd love to talk a little bit more about that with you. First, let's explore how radiology's role is really evolving across sort of the broader healthcare landscape.
So radiology is really playing an increasingly integral role in healthcare. And what we're seeing is a transition from purely clinically based diagnoses in many cases to imaging based diagnoses. So I'll give you one example, but there are many. So for example, Alzheimer's disease used to be a clinical based diagnosis. Now it's a biomarker based diagnosis, and each of those biomarkers you can detect with imaging. So amyloid PET to detect the amyloid, tau PET to detect the tau, and quantitative MRI or FDG PET to detect neurodegeneration. It's very important, and the reason why that shift is we can use these biomarkers to detect disease earlier. Amyloid is present at the very earliest stage, even before the patient is symptomatic. And so, in my opinion, really imaging has become a part of essentially everyone's healthcare journey. And with advances in population health radiology initiatives, we're seeing an evolution from sort of the reactive disease detection to more of a proactive, disease prevention and early diagnosis. And so I think one of the most exciting things really is AI's ability to stage shift early detection of disease, to really move the needle forward. So if you look, for example, I can speak about like RadNet Deep Health, like their AI solution for breast cancer, so their screening tool. It's detecting cancer 21% more than just a human alone. In fact, 1 to 2 years before a human. And if you think about it, they do, 2 million mammograms a year. That's 5% of the population in the US. Makes a big difference because the stage you diagnose can impact morbidity and mortality. Their lung cancer detection tool, when a cancer is detected, it's detected 76% of the time at an earlier stage when you use the AI tool. Prostate, similarly, 27% increased detection of clinically significant cancer when you use the tool. And it's not just oncology. So for example, the number one killer is heart attacks, right? Yeah. So if you use AI in combination with coronary artery calcium screening, you use that AI to evaluate the plaque, you change management 50% of the time. And then in neurodegenerative disease like Alzheimer's, again, we are shifting that stage of disease by catching it earlier with AI tools.
Oh, that is making a massive difference, not even a small difference, quite frankly. And when you start to think about some of these trends that you're talking about, I feel like we almost even really touched on some of this, because when you tell me that 20% our patients are being, found when it comes to like breast cancer early, that's having a huge impact across the imaging enterprise, more for the patient itself. But as you think about these tools, which ones would you say have the greatest impact for the sort of imaging enterprise?
Well, I think that AI in general is impacting every component of the imaging enterprise. But I would say probably some of the biggest trends that I'm seeing in radiology, like the type of things that we're seeing here at RSNA today, would be the impact of volume. Our imaging volumes are going up at such a rate that we're exceeding the technologist workforce right now. So like, for example, our amyloid PET volumes are up over 7,200% in the last couple of years. We do 7,000 amyloid PETs a year. Our MRI brain volumes are up 12%. We do 393,000 MRI brain studies a year. MRI breasts, again, up 20%. PET CT up 20%. All of these volumes are going up, and there simply aren't enough expert technologists. So we have to think of innovative ways to make up that difference, right? And so I can tell you, like what RadNet's done, one of their programs, it's called Tech Live. It allows an expert tech to remote in to an MRI scanner, and not just MRI, the CT, ultrasound, plain film as well. Remote in either control, fully operate, or assist the technologist that may not have as much experience and actually, perform the exam and help them along the way. This type of technology has resulted in 42% improvement in MR room closures. It's making a tremendous difference. So improving access to care. Other things that we use to help with tech shortage is deep learning for image reconstruction. It allows us to scan our patients 50% faster, but with improved image quality. But that means the technologists can finish their workload in the day, because we can theoretically scan, we are scanning 3 to 4 more patients a day because of this technology. But it also prevents having to find people that will work overtime. So those are a couple of really exciting things. So the other thing RadNet does is they sponsor a technologist training program called Imaging Works, and then they hire directly from that pipeline.
Wow, that's really great. You mentioned something about access to care, and I think that's really important because there are certainly lots of underserved populations. There's rural health areas that have limited access to some of the, more, facilities, like a facility like yours, for example. When you think about some of these tools and some of these trends, are any of them, out there that are helping to maybe even increase access to care?
No, absolutely. I think if you combine creativity, ingenuity, and technology, you can actually really make a difference in reducing that equity bias. Like for example, RadNet, they created something called Maddie the Mammo Coach. And this is a bus that's loaded with the latest AI technology and mammography, and it drives into underserved areas and performs mammograms. They get the exact same technology anyone else would get, but again, can impact patients' lives. A lot of these patients have never had a mammogram before. And so we did like 9,000 of those studies. The other thing is, like, for example, they placed a mammography unit in a super Walmart. So in a super Walmart, you're able to get to a relatively, often an underserved population. And so it showed that when there were many more first-time mammography patients there that came to Walmart than what would come to a traditional imaging center. So those are just 2 examples. There are plenty of other ones, but I do think it is important to be creative about reducing equity bias.
I love it. I love it. So as we sort of wrap up here, Suzie, we've been at RSNA for the last few days. As you just mentioned, there is so much going on here on the floor of RSNA. There's a whole AI innovation area. What would you say are some of the things that stand out to you the most, the key takeaways from RSNA 2025?
Well, the theme for RSNA is imaging the individual, and I love that theme for this year in particular because what I'm really seeing, the trend I'm seeing, is much more personalized, patient-centric imaging initiatives. And you see that across the board here. And so I think that is really the trend that we're seeing. And there's, we have like 660 vendors here at RSNA this year, but that I'm seeing as a big focus, and it's kind of exciting. So it's happy to be here, wonderful to be here with you again this year.
Suzie, it is really always a pleasure. I want to thank you for taking a moment to sit down here with us at Applied Radiology, for your ongoing support of what we do here, and it's always a pleasure to talk to you. Thank you so much, Cindy.
Thanks, Kieran.